Deputy Speaker, my question without notice is directed at the Minister for Health. Mr. Deputy Speaker, in my long professional career as a doctor in this beautiful country, and as former Secretary for Health and as former Minister for Health, I have never seen a health situation in this country that we are going through today. It saddens me enormously, and I must say that our health system has broken down. I want to read to you one of the 7 public notices put out by public hospitals throughout the country. And it will highlight the desperate situation that we are going through today. And this notice is signed by a Dr. Tati, Director of Curative Services of the Hela Provincial Health Authority. His subject was scaling down of clinical services and elective surgery at the Hela Provincial Specialist Hospital. And the reason why he put this notice out, like all other 7 notices that are now finding their way in the Facebook, is that there is continuous stock out of drugs and medical consumables at the area medical store in Mount Hagen and a cash flow problem in Hela province. And therefore, the following services will be closed down. 1. All specialist consultation clinics. So any patient that needs a specialist doctor will not be seen by a specialist doctor. That's what it means. 2. All elective surgeries to stop immediately as of this notice, which was on the 20th of October 2025. And number 3, no elective referrals out of the province, only those regarded as emergencies. And Part B says referrals for advanced diagnostics like CT will be at the expense of patients and their relatives. So this government, Mr. Deputy Speaker, is now bringing health costs to patients and their relatives. The system has failed. My questions are, number 1, Deputy Speaker, when was the last public tender for medical supplies tendered by the Department of Health? I understand that there hasn't been a medical supplies public tender for a long, long time. The system that I established meant that the country must have 6 months supply of cushion, that you must have 6 months stock ready all the time. And so the tender processes must be managed in such a manner that we don't run out for 6 months supply in this country. That system has failed. I want the minister to advise when was the last public tender for medical supplies publicly tendered by the National Department of Health. Then I want to ask the minister through you, Deputy Speaker, what happened to the M system? Because without the real-time information coming from all the facilities throughout the country, then the department is going in the dark. We don't know what's going on. I have had many friends and many relatives who come up the Port Moresby General Hospital, the premier hospital in this country, come in with a prescription, asking me to go and buy this drug because it's not in the hospital. Many doctors are writing prescriptions and even telling patients to go and buy the drug. Not only the drug, but the prescription also include needles, cotton wool, gauze, IV intravenous fluids, and even oxygen cylinders, Mr. Deputy Speaker. So somewhere in the system, our people are suffering because this government is failed to manage this essential service. Health is an essential service. And I can tell you, Deputy Speaker, many of our people are dying out there because this system has been made to fail. Thank you, Mr. Deputy Speaker.
The Honourable Minister for Health.
Thank you, throughout the Deputy Speaker. Midok thank you, Lord. Or couple of questions come along. Many about law, Dr. Law, conscious law, health law, country blame me. Yes, me, maybe agree with Dr. Bolsem health and critical need service. People blame me. Very, very important. Second, third, first, Dr. Law, when was the last public tender? An important point. Let me check the department tomorrow. I mean, now, Dr. Sabe come back. Now, purchase orders. I'm only important Dr. We need law present good.